Age is not enough reason to die. Females have harder than males do. Reproduction is hard work. Even when after reproduction pass, females carry additional risk. Half an hour before closing, we get a phone call. A client wanted a home visit to euthanize his 15-year-old Aldertier, sad by the natural demand. It was 10 minutes ride to get there, and the procedure was only supposed to take a few minutes. Indeed, when the doctor came to the client home, he found a lethargic, deeply dehydrated, skinny dog lying on his bed. Only his breathing showed that she was still alive. He also saw a lot of pus on a towel surrounding the dog's vagina. The diagnosis was obvious: pyometra, inflation of the uterus. "Why don't you bring your dog earlier?" asked the doctor. "She could have been saved." We figured it was just her age. Age is not a diagnosis. Nobody dies because of age. It's only disease, trauma, or abnormalities that can cause death. Even now we can try to save your cat. Oh, we would be glad to do so, please. The dog was brought to the hospital. The doctor and his assistant stayed a couple of hours later to perform surgery and to supervise the recovery. The recovery was not easy, but the 14-year-old Aldale was good. A few days later, the owner and the Aldale visited the doctor with flowers. 10 months later, the dog passed away peacefully in her home from a heart attack, but she got nearly another year added to her life, and the owner were thankful for the miracle that had prolonged the life. Maybe because of mistakes in education, and maybe because of just human nature, it sometimes occurs that after the effect, people tend to pin the event as the cause of it. For some reason, nobody thinks there is a reasonable, casual relationship between yesterday's TV program and today's flea infestation in her dog. But to say that the flea had appeared on the dog a week after a visit to the grooming salon where we fight with fleas with professional strength, where the fault of grooming salon is perfectly logical. The owner will not take into account that since the grooming visit, his dog has walked on streets, played in the play park, and met other animals in the neighborhood. He won't recall he forgot to take any anti-flea measures in his particular summer months, and will insist until the last minute that it's the groomer's fault. And this is not always an attempt to save some money. Usually, it's a sincere belief that anything that happened after the event happened because of it. And all dogs start limping as it is because the vet technician did something wrong while vaccinating it 3 days prior. The cat stopped eating, it must be because the groomer put soap in his mouth. A cat got an ear infection 3 days after our vaccination. Well, it certainly occurs because of the vaccination, and the doctor should take care of this problem as the follow-up for free because it's his fault. Logic is clearly not our customer's strong suit. Ready food versus adequate in a mouse. What is the difference between ready food and natural one regarding their process in the mouse? In general, ready food differs from natural one by being more concentrated, less watery, and being more dispersed. Respectfully, it needs excessive saliva production. It doesn't need significant mechanical work for crunching of the meal. Not only canned food is solved from very beginning. Often it paid, sometimes in form of small pieces, can be swallowed right away without chewing. But even in dry food, being crunchy easily became like a powder and after light pressure under the teeth. This difference leads to two major deviations in mouth functionality: less work for teeth and more conditions for dental, tartar, and gums, and irritation and infection. The absence of hard work for teeth makes them weaker, while palatable sediments on teeth and gum is a good nutritional base for excessive growth of unwanted microflora there. For instance, in my experience at the vet clinics show that pets which get ready food pluggy on their teeth even at 1 to 2 years of old, although animals on natural food rarely have any dental deviation till much older age. Time to time, dental cleaning doesn't fully compensate oral cleansing while chewing on natural food. I don't know proven evidence about significant side effects of high salivation, but I guess they might be. Salivation is strongly connected with appetite and feeling of hungry, so normal salivation may cause influence on this important way of oral regulation. On the other side, tartar on teeth and infection at the mouth are well-proven cases of serious dental problems, and beside damage to pet health leads to significant vet bills for the pet owners. Reasonable question how to compensate the effects on ready food if the circumstances do not lead that forced to replace natural food. I see only few advices: to use chewable treats, or B, to provide plenty of water, and C, to make dental cleaning and mouth washing a routine. Unfortunately, though, some animals, especially cats, don't like chewable treats. It's hard to push pets to drink more water than they want. Regular teeth cleaning is not easy to many pet owners. So one more advice can be done: use supplements which will protect teeth and gum. For instance, dental tea of VetVittles wash out traces of food from the mouth, somewhat disinfect cavities, and being tasty for pets may evaluate water compensation. Future opposites to publish: fresh food compared versus storage one. B. C. Different fortunes of ready food versus natural ones while food processing in the lab gastrointestinal tract. D. Different fortunes of ready food versus natural one in the post-gastric and bowel. Ready food versus natural one, role of food diversity. Sterile food versus natural. H. Relationship between adequate and natural terms.